Afternoon, everyone, or good morning or good evening, depending on where you are following us. Thank you for attending this third CyberPeace Lab. Different from last time, I will not speak too much because we have a very, very good and very rich panel, and I would like to give the floor to our panelists as fast as possible. I'm presenting here who they are with their name, and we have the pleasure to have especially Duncan Hollis as our moderator today. And I promise to Duncan I won't be long, and that's me now fulfilling my words. So please, Duncan, for the opening.
All right. Well, thank you, Stefan. As the little screen just showed, I'm Duncan Hollis. I'm a professor of law at Temple Law School in Philadelphia. I'm also a member of the Organization of American States Juridical Committee, where I'm a rapporteur on a project trying to improve the transparency of how states understand international law applies to cyberspace. And I, for one, I have to say I'm so pleased to participate in my inaugural CyberPeace Institute event. It's an organization I've long believed we needed to have in cyberspace. So see it to arrive and launching events like this one. I guess we're calling it COVID-19 Infodemic. Thinking about how we can defend the health sector from cyber attacks, and more specifically how cyber operations transgress or implicate international law and norms. I'm thrilled to be moderating this panel that you see here before you, a true expert group. Let me briefly, very briefly flag who we have. First, we have Maricha Sciacca, president of the CyberPeace Institute, a former member of the European Union Parliament, and currently, I believe, International Policy Director at Stanford's Cyber Policy Center. Next, we have Jan Neutze, who is a Senior Director for Digital Diplomacy at Microsoft, where he heads its Defending Democracy program, as well as working on advancing the rule of law to stabilize cyberspace more broadly. Professor Michael Schmidt, newly arrived at the University of Reading Law School, well known for his efforts at corralling a group of international experts and then editing not one but two Tallinn manuals, one on cyber warfare and one on state cyber operations and international law. And finally, Dr. Tilman Rodenhauser, who's a thematic legal advisor at the International Committee of the Red Cross, whose past work includes a monograph on non-state actors under international humanitarian law, or what I'll call IHL. So a deeply qualified and experienced group to discuss cyber threats in the healthcare sector. And that's where I thought I'd begin. Thinking about the particular threat matrix we are seeing here, particularly with respect to those threats that have emerged alongside COVID-19. By my count, I've seen no less than 5 different types of cyber attacks that we might distinguish for legal or normative reasons. So first, we've had cyber attacks on hospitals themselves. The Czech Republic's hospital example being probably the most prominent. Second, we've seen some cyber attacks on research and development facilities and factories and companies that are working on antiviral medication or vaccines. This occurred, for example, in the United Kingdom. We've seen some cyber operations targeting the World Health Organization, an intergovernmental organization that has obviously been pretty prominent in the fight against COVID-19. Fourth, we've seen a number of cyber operations targeting government agencies that are focused on health and human services and are also responding to the crisis. And then finally, we're seeing I believe mostly cyber criminals, posing and using phishing attacks to pose as either WHO or other healthcare related actors in phishing campaigns to access otherwise unsuspecting users or networks. So that's my view, but I wondered if we could talk a little bit about what the threats are with our panelists. And so I guess maybe Jan, or maybe actually Maricha, one of you, have I got the list right? Is this what we're seeing? What are you seeing out there in terms of healthcare sector related cyber operations and cyber attacks? And maybe Maricha, if I could, I'll start with you. We'll see how the technology holds up.
Thank you so much. Thank you for joining us at the CyberPeace Institute. It's a real pleasure to have this third webinar to deal with questions around how COVID-19 creates basically new opportunities for those who want to do harm. And I think for people who are trying to deal with this epidemic in their own lives, it is hard to imagine that people would like to exploit the fear and the vulnerability of this moment in time with so many people online. But it is important that we see it for what it is. So the kinds of threats and attacks, we could talk about more in terms of methods, like ransomware attacks or DDoS attacks or phishing. But I think it's also important to talk about a secondary kind of effect, which is the fact that there's so little accountability when it comes to the perpetrators of these attacks. I worry a great deal that those who want to do harm, whether it's criminals or states or other types of non-state actors, that the fact that there's so much impunity, in other words, so little consequence to these crimes and harms, actually creates another level of harm, which is that the average citizen who may read about hospitals being attacked or governments being attacked, or who themselves may have become victims of phishing and malware, never read about consequences, never read about these criminals or state actors being held to account. So I think that that's really important. And for us to shine light on what is happening, whether it is disinformation or whether it is the geopolitical stakes that are being battled out at this moment in time, I'm hopeful that through creating clarity on what is happening, from the kinds of attacks that you've just sketched to a greater detail of what these attacks look like, we can bring this higher up the political agenda, have a stronger public debate about what is happening so that people are more empowered, and so that we will actually see an end to the impunity that is now, I would say, a secondary harm of these dreadful attacks that we see happening on health facilities.
Yeah, well, thank you. I think that's exactly the sort of thing that I think we should focus on, which is it's not just the attacks, it's the impunity that seems to be accompanying them, and the accountability question. Jan, from Microsoft's perspective, are you able to speak from a tech company perspective in terms of anything that you all are seeing that I haven't mentioned, or reinforce anything I have suggested?
Yeah, let me pick it up there, Duncan. Thanks so much for this. And I'll just say, from a Microsoft perspective, very clearly, we are hugely concerned about these type of attacks that we're seeing. As Marietje rightly pointed out, they are not only concerning, but at the end of the day, they're affecting real people. They're affecting patients in hospitals. They're affecting doctors and other medical staff on the front lines who, at the end of the day, need to be able to do their job uninhibited. And from what we've seen, whether it's the attack in the Czech Republic or against organizations helping to coordinate the global response, such as the World Health Organization, or here in the US, the Department of Health and Human Services, all of this to us is hugely concerning. I'll say that we have, our security teams have certainly detected and responded to these type of attacks, coming both from criminal groups as well as multiple nation-state actors. And maybe I can give everyone a few additional data points which may be relevant in that context. And that is, first of all, our systems have picked up COVID-19 themed attacks in every country around the world. So every country has seen at least one or more COVID-19 themed attacks. So the scope of this problem, as far as we're concerned, really is global. Phishing campaigns, as you mentioned, Duncan, are by far the largest threat vector. And of course, there are thousands of phishing campaigns sending out millions of malicious emails. Our systems are picking up roughly 80,000 COVID-19 related malicious emails per day. And while that, of course, may sound like a lot, it still constitutes approximately only 2% of all malicious emails that we do pick up. So I wouldn't necessarily say we're seeing an overall surge in attacks, but certainly attackers are pivoting and are using the attention that the world is now paying to COVID-19 to actually be more nefarious and using COVID-19 themed lures to get into people's and organizational systems. And so that can be impersonating, for example, the World Health Organization. We've seen things that impersonate the Centers for Disease Control or HHS here in the US. And so that is, of course, hugely concerning. I just want to make one other point before we move on beyond the threat landscape, and that is, while of course there's a lot of attention focused on attacks against medical systems and healthcare facilities right now, as there should be, as these attacks are happening, it's not the first time that we're seeing this. And I just want to recall that back in the WannaCry attacks that we saw, the ransomware WannaCry attacks in 2017, let's remember that one of the biggest organizations that were impacted, although they may not have been the primary target, was the National Health System in the United Kingdom, where 19,000 appointments by some measure were forced to be rescheduled. So again, I want to emphasize that while we're talking about these numbers, at the end of the day, real people and real patients and real medical staff are directly impacted by this, which is, I think, what we should always put front and center and collectively need to raise the urgency as we are doing today, and I think call on governments and industry and civil society to do more to address this. Thanks.
Yeah, well, thanks to both of you. I think both the call for more accountability and the suggestion that we're in an existing state of impunity with respect to these attacks that Maricha suggested, and then Jan, you, I think, poignantly remind us this is not the first time we've seen ransomware, for example, targeting healthcare, hospitals, healthcare facilities, and the like, which I think makes me want to pivot a little bit to the question of, this is not terribly novel, and so we've had some time to think about targeting healthcare systems and hospitals. And I think one of the interesting things about the WannaCry example was how states reacted without invoking international law, although some invoked international norms. So I wonder if we could pivot a little bit to the question of how does law deal with this threat matrix, with cyber operations targeting hospitals, targeting healthcare workers, using phishing attacks, posing as the WHO and the like. And I'm going to turn now, hopefully, to maybe Tilman and Mike to start us off. But before I do that, I just want to flag that if anyone in the audience has any pressing comments, you can use the live comment feature and weigh in, and I'll try and navigate both moderating this distinguished group and feeding those comments into the conversation. But turning maybe first to you, Tilman, if I might. Obviously, the International Committee on the Red Cross focuses on armed conflicts and international law's regulation via international humanitarian law. I wonder if you could talk about how international humanitarian law protects the healthcare sector and whether you think those protections are particularly relevant today.
Yeah, thank you very much, Duncan, and also thanks to the Cyber Peace Institute for having me on this seminar. I think Jan just said that it's very important to realize that behind attacks against hospitals, there is not only the hospital, but there's actually human harm behind it. And when we look at international humanitarian law, which is the law applicable in times of armed conflict, so in times of war, we have in that body of law very strong protections against any kind of attacks against hospitals. Hospitals, medical staff, medical units have to be protected and respected. And I come back to these two terms. But, when maybe not everyone in the audience will be very familiar with the laws of armed conflict. Let me say two words about that and then turn to how that's relevant today. The laws of armed conflict have been agreed by states, and they're today enshrined in a number of international treaties, including the Geneva Conventions, the additional protocols. Many of these rules have achieved the status of customary international law. And as I said, there are very strong protections of the medical sector in there. And when we think about it, it makes sense. In armed conflict, one thing that both combatants, fighters, but also civilians need is medical care. And that's to some extent the same what we see at the moment. What really everyone needs is medical care. And in times of armed conflict, this strong need has been addressed in humanitarian law through strong protection. So when we look 150 years back, the first Geneva Convention, the very first article is actually about respect and protection for medical units. When we now, of course, these rules 150 years ago, no one has thought about cyber attacks. But when we look at these rules, they are still as valid today. And actually, I would say most experts, of course, the ICRC, but also an increasing number of states agree these rules apply today. They are just as relevant today. So what we have is a strong legal framework. And I would make, with regard to the current crisis, 2 points. One is one of limitation. International humanitarian law, despite having this very strong framework, only applies in times of armed conflict. So only if an act has a link to an armed conflict, these rules are relevant. And when we then look at some of the attacks that you mentioned, they occurred in countries that are not involved in armed conflict. And it's also, no one really knows who's behind them. At least it's not in the public. So it would be difficult to make a link here to international humanitarian law. So it don't apply to many of the attacks that we've talking about. But at the same time, when we look at the virus has been affecting essentially all countries in the world. It also has spread into context of armed conflict. Think about Syria, think about Libya, think about Ukraine. And here, these rules are relevant, and these rules do prohibit attacks against hospitals and against other medical facilities and personnel in these contexts. And the second thought, or the second point I would make is probably a bit more forward-looking. When we look at the history of humanitarian law and how it has been codified, how it has also been improved and developed, these developments often came after the fact. They came after the horrors of war, after all the suffering that has been seen. States came together and agreed, either codified rules that have been existing or agreed on new rules. And to some extent, we would have the hope that this current crisis could also be put the urgency of protecting medical facilities against harm from cyberspace firmly on the agenda, and also lead to an affirmation that this is prohibited and this should be prohibited under international law.
Thank you, Tilman. So I wonder, Professor Schmidt, Mike, if you obviously have a long-standing expertise in IHL, so I'd invite if you have any additional comments on that front, but I wonder if you might also expand the aperture a bit and talk about other aspects of international law outside of armed conflict as well, in terms of these attacks and how international law would deal with them.
So let me start with the IHL piece very briefly. I would agree with virtually everything Tilman said, every word. And moreover, I would say that the experts who did the Tallinn Manual project would also agree, because we started with regard to IHL. And moreover, having worked with governments and for a government for decades, I believe most governments would also accept the points that Tilman made. So I agree absolutely with him on those. The problem is most of these operations are not occurring in the context of an armed conflict and are not, as Tilman said, subject to IHL. So what law does apply? Well, I think general international law applies, and whether or not the operations are unlawful in international law very much depends on who did it. If we're talking about a non-state actor, and a non-state actor is conducting the hostile operation against a health facility without a nexus, without a connection to a state, then it isn't international law that applies. It's domestic criminal law, and so you have to look at the domestic legal regime. I would caution, however, that in the event that you have these operations occurring, states may have a responsibility to take measures to put an end to those hostile operations, because states under international human rights law have an obligation to protect the right to life and the right to health. So states may have an obligation consistent with their other human rights obligations, like safeguarding the freedom of expression, to take measures to put an end to these operations, if those measures that are feasible. International law really comes into play, though, when you can say a state did it. And there are a number of ways you can say a state did it under international law, but the two big ones are an organ of the state did it, their cyber entity, their armed forces, an intelligence agency, or alternatively, a non-state actor did it, operating pursuant to, and here the legal standard is, operating pursuant to the instructions, the direction, or control of the state. It's once the state is acting that international law prohibitions come into play. Now, the issue of attribution was raised earlier in the presentation. I would say here there's a big question out there on how much information do you need. You certainly don't need absolute certainty to attribute an operation, a hostile operation, to a state. You need that amount of information that a reasonable state would act on, would make allegations on in same or similar circumstances. Now, that's, if you will, that's the easier piece. If a non-state actor did it, you look at domestic law. If a state did it or the action is attributable to a state, you look at international law. To make it unlawful, you have to find a rule that's been breached. The one that is most likely, in my mind, is sovereignty. Now, as a lot of folks know, there is a debate. One state has taken, the United Kingdom has taken the position that there's no such thing as a rule of sovereignty, that sovereignty is not breached by virtue of cyber operations. The United States seems to lean in that direction, but has not definitively taken a position yet. Most scholars and most states, though, believe there is a rule of sovereignty. And for them, by the way, it's my view as well, for them, the question isn't, is there a rule of sovereignty, but when is it breached? With respect to these operations, there seems to be general consensus that if a cyber operation causes injury or death, or foreseeably could cause injury or death, then in that case, it's a breach of the state into which of the sovereignty of the state into which the operation was conducted. So in these cases, most of the operations, if attributable to a state, are clear violations of the rule of sovereignty. They may also be violations of the rule prohibiting intervention into the internal or external affairs of other states, because an internal affair includes the state's right to determine how it is going to handle a medical crisis and the actual handling of that crisis. And if another state is interfering with that right, causing the target state to be unable to carry out its plan and to be unable to address the medical crisis, then I would also style that a violation of the prohibition on intervention. And finally, Duncan, there is the prohibition customary international law. The question we have always asked is, where is the threshold? What type of cyber operation trips over that prohibition? But I think there's pretty widespread consensus that if the operation is going to cause death, injury, illness, or is likely to, then that would be a violation of the prohibition on the use of force. So in all of these cases, international law, the fact that the operation breaches international law, at least some norm of international law, would be pretty clear. The big question is, who did it?
Well, thanks to our resident international law experts for both of you on that. So, to summarize, IHL clearly, international humanitarian law clearly protects hospitals, medical facilities, medical workers in armed conflict. But we see a range of protections that should apply, or that do apply, also in peacetime, including a rule of sovereignty, although there's some debate about the existence of that rule, perhaps the duty of non-intervention, and maybe even the use of force. But to tie it back, I think, to the question Maricha, or the point Maricha started us off with, we've had the accountability challenge, which is, when, for example, WannaCry happened in 2017, states didn't invoke any of these international law rules to suggest that a state actor, if it was responsible, as many assume, had violated international law in some way. Rather, we saw language about norms, norms being kind of, I guess, often thought of as socially constructed rules that are, binding on the community as a matter of international relations, not necessarily as a matter of law. And I wonder if I could open it up to all of you to where you think norms fit into this conversation. That is, we have a long-standing set of international legal rules and regimes that can be applied, from human rights to international humanitarian law. But we've also seen, especially since the UN group of governmental experts in 2015, an attempt to articulate certain norms about critical infrastructure. And maybe, Tillman, I might start with you here. More recently, the ICRC has suggested a norm specifically focused on the protection of the healthcare sector. But I maybe I'll start with you, Tillman, but then offer everyone's opportunity to chime in on where norms fits into this equation.
Oh, thanks, Duncan. And maybe let me start with a quick thought on your first question, which is how do norms fit into the picture? I think norms, of course, have the advantage that they're not law. So they can likely be faster adopted, faster implemented. They don't need ratification and translation into national law. But there might be something that's politically easier to adopt, which can be of great value in this rapidly moving field of cyberspace. I leave it on that. on this point, but rather turn to what recently happened, what you referred to, that the ICSC actually suggested already in February a norm at the open-ended working group, which is one of the UN mandated bodies that looks at norms of responsible state behavior. We pitched there a norm that would say that states should not conduct or knowingly support cyber activity that would harm medical services, and also that states should take measures to protect medical services against harm. And that really comes from that norm or that concern of ours arose before the COVID crisis. When we looked at how can cyber really lead to human harm, we spoke to a lot of experts about that, and what they said is exactly what came out from some of the discussions we've been having here, namely that that medical facilities have a big attack surface. They're digitalizing, but at the same time, they're not well protected. So there is a real risk of harming humans. We've pitched that norm, and as you see, it has two elements. It has a prohibitive element of not conducting certain things, but also a protective element to take measures to protect. And it is very well, or it is modeled after what I said about international humanitarian law, but also what Mike said about general international law. So there's something that we pitch that should apply at all times. And what's interesting is that in the past weeks and the past months with the COVID crisis that we're all going through, this norm has received a lot of attention. It has also received significant support and recent statements by states, also by Microsoft, which was great to see. And we hope that actually this norm, as you said, a socially constructed rule that is accepted by all states, can actually be something that is be taken forward this year in order to restate this consensus by the international community that healthcare attacks should be prohibited.
Yeah, certainly a powerful norm. We've begun some live chat comments, so I can bring them in, but I want to see if anybody else has thoughts on the normative space. And also, I don't mean to exclude the international law. I certainly think we didn't actually delve into that much how international law might also provide positive obligations. I think, Mike, you referenced some. But it seems that the norm that the ICRC proposing has those two parts, to restrict actions against healthcare, but also to require protections more affirmatively. But what do others think on the normative question?
So I'll take that on. I think we need to be very careful about this, about pursuing norms. First of all, the ICRC's norm to me is a classic international humanitarian law. It's the law. It's not a voluntary, non-binding norm. It's international law. The problem with the quest for norms is that when a norm is articulated, it has distinct from a rule of international law or the interpretation of a rule of international law. What happens is they may be misunderstood. And when you articulate a norm, to some people that suggests that there's no binding international law. In fact, when a norm is agreed on by states, what that actually reflects is that there may not be complete consensus on whether or not that particular norm is a binding rule of international law. And so what happens is that states sometimes take the easy way out, because they know there's going to be a tough debate over whether or not there's a rule of international law. And so they quickly agree that there should be a norm, as in the GGE, they're called voluntary non-binding norms. The problem is that voluntary non-binding norms don't have remedies. International law triggers remedies on the part of victim states, like countermeasures, like the law of self-defense, for example. Whereas voluntary non-binding norms trigger no response other than simple acts of retortion, which are unfriendly activities. So I think to some extent, the norm dialogue is taking the easy way out, avoiding the hard work of getting states together and having a serious discussion about what the parameters of international law are, how we would interpret it in a particular circumstance. And I'll use one example. There is a debate over whether the obligation of due diligence, the obligation of a state to ensure that harmful actions are not, harmful cyber operations are not launched from or through their territory. There's a debate over whether that's a binding rule of international law or simply a voluntary non-binding norm? Well, here we are. There are lots of states from which, as Jan pointed out, from which hostile operations are being mounted or through which hostile operations are being mounted. If due diligence is a rule of international law, then there's not a scintilla of doubt that those states, those transit states, those states from which they're being launched, would have a legal obligation to put an end to them. And if those states did not, there would be legal consequences for their failure. But by adopting due diligence as a norm, because we don't want to do the hard work of identifying the international law, those states, there is no action that can be taken against those states for their failure to take action, for sitting on their hands while these operations threatening the health sector are being launched. So we need to be careful about this norm debate. It has consequences.
I think that's, yeah, I think that's important, and I think I heartily agree that even diplomats sometimes, I'm not sure, understand the difference between norms and law, and kind of equate norms with things that aren't actually binding. When in fact, social scientists would tell you, what law aspires to is to be normative, is to change people's behavior, and so how people use the terminology matters. I see both. Rufo and Byron have in the comments kind of layered on top of our normative discussion a question about whether you need some sort of interdisciplinary team to build a greater framework for cyber norms, or Rufo asks, wouldn't norms be useless or worse unless there's some body to enforce them and a technical feasibility to apply them? So I don't know, either Maricha or Jan, you've been both working in this norm space for a while. How do you react to the idea of either a need for more interdisciplinarity in constructing norms, or the need for some sort of body to exist to monitor their operation? So Maricha, I think we're having a little trouble with your...
I was muted by the host, but I think I'm unmuted now, so hi. I wanted to build on what was said about international law by Mike, because I think it is extremely important that there is an interpretation of existing law in the current context, right? Because a lot of core principles that are enshrined in law, such as territoriality, for example, or the prominent role, or maybe even the exclusive role of states when it comes to engaging in these international law negotiations and agreements, as well as deciding what the sanctions should be in the case of violation, leave out a whole bunch of actors. For example, non-state actors, whether they be criminal groups, terrorist groups, they could be outsourced to do the work of states, but they could also just be organizations that have their own objectives to pursue. And I think also importantly, we haven't talked so much about the role of the private sector. All in all, I think digitization has seen a huge redistribution of power that has not been met with a similarly redistributed oversight and accountability mechanisms. And while I agree that international law and its application are the ideal solution, another way to look at norms is to an avenue to have standards instead of having no avenues. So in one analogy, one can see it as a wall, which is how I'm paraphrasing what Mike said. It would hinder people from applying international law, which is, the difficult work, if you will. In another way, you can look at it as a first step toward international law or accountability standards, short of political will to actually apply international law as exists. So I've been part of a number of processes where multiple stakeholders, so technologists, civil society, people representing international organizations, the private sector, and governments, have come together to say where are the vacuums that we need to fill in.
Okay.
The way I see it should not come
yeah,
instead.
Maricha, I'm just letting you know we're having you're cutting in and out a little bit, but I want to see if we can't pick up that last point again. If you want to try it, and if the audio is cutting out, I'm gonna unfortunately cut you off, just because I know you're speaking, but not all of it's coming across.
Okay, so I'll be brief, but my point was that I think it is often intended as a step towards international law, not as a step away from it, and it allows the private sector and other non-state actors to be a part of the norm.
Okay, great. Yeah, thank you for that. Jan, did you have anything to contribute on the normative front as well?
Sure. Maybe just to build off of what Marietje just said, from just purely speaking for Microsoft, maybe not industry broadly, although I think there's interest across the industry in particular in being more involved in these discussions. I hear Mike's point, and I would agree that I think it is critical that governments and nation states writ large do the hard work to actually determine how international law applies to cyberspace. But I want to pick up what Marietje said. I think, from our perspective, given the current political environment and all the geopolitical tensions that exist, norms may be an adequate in-between step or an intermediate step to actually advance some of these protections in the short term. And this is why, from our perspective, we have tried to engage in a constructive way in these norms dialogues. We, as Tilman mentioned, noted with great interest that the ICRC put forward actually prior to the broad outbreak of the and spread of this pandemic in December 2019. We think is a really important contribution to this norms discussion. So I would encourage everyone to take a look at that. And then the other thing to point to is, again, these concepts are not new in and of themselves. When you alluded to this, Duncan, when we go back to the July 2015 report by the UN Government Group of Experts, I'm just going to read it real quick. It says the state should, it includes a relevant norm here. There is a state should not conduct or knowingly support ICT activity contrary to its obligations under international law that intentionally damages critical infrastructure or otherwise impairs the use and operation of critical infrastructure to provide services to the public. That pretty clearly spells out what is at issue here, and that is that hospitals and other medical facilities that are in most countries around the world designated as critical infrastructure should be off limits. So again, the concept is not new. There has been agreement at the international level for a number of years, and as Mike rightly pointed out, there are and Tilman pointed out, there are in addition to these normative steps, clear prohibitions in existing international law, and the combination of which is, I think, what we need to get governments to acknowledge, to uphold, to respect. And then coming back to what Marietje said at the beginning, we need to work on accountability, because just stating a norm and even just reaffirming international law probably isn't enough. We need to get to the second and third steps here, and that is accountability and consequences.
Yeah, so I think we're starting to build a coherent theme to all the interventions in terms of pairing these both the development and evolution of law and norms with accountability and trust, and you're seeing that in a number of the comments. I noticed, like, Louise Marie Harrell has asked about whether or not norms are necessary to the role of trust building in this community. And I think that's been the challenge. We have a 2015 GGE norm on critical infrastructure. We've had efforts, whether it's the Global Commission or the ICT for Peace, also calling for protection of critical infrastructure, and yet, we continue to see operations targeting that very infrastructure, and most visibly these COVID-19 related healthcare targeting. Let me ask you all then I kind of a question that's lurked in the background, and ICRC may already be out in front of this. So we have clearly existing law, right? We clearly have that. We have some norm candidates or norms that are already out there as well. Do we need new rules? That is, is there something that would new rules improve the situation, separate and apart? And I want to come to the accountability and the what I'd call operationalization in a second. But let's first see if we can't lock down where you all stand on whether or not these healthcare sector attacks suggest that we might benefit from new international law, or I think, as the ICRC suggests, maybe some new articulation of a norm.
I'll start by saying I'll start by saying that I think it is most important to focus on getting the political will to operationalize existing international law. There's still a lot of room for better application and for building coalitions that are going to see to that happening. And I think that if that gets the attention that it deserves, the political attention and also the spotlight that we need to shine on it, so that the price of neglecting to actually, bring more compliance or more consequences to violations of existing international law is not just, moving to the background. So I would say be careful with pushing for new standards, also because the balance of power globally is not in favor of democracies. And so once a process is started, we've seen this over and over again, the risk is also that it could end up with a standard that is actually not a better protection than what we have, and it could actually serve, let's say, authoritarian states that are trying to shape rules of the digital world in their mirror image, which, as a believer of a more democratic governance model, I would find a loss compared to the status quo.
Thank you for that. I wonder, Mike, one of the questions people have asked, and this may go to the question of whether you think we need new international law here. I don't expect you, given your earlier comments, to opine on the need for new norms. There's a question Goran has asked if you've shifted to the ICRC position that not only death and injury need to occur, but destruction and neutralization of cyber infrastructure would be covered by the existing IHL. And so I guess that may be a relevant inquiry in terms of where you stand on whether we could use new international law in this space, the healthcare space particularly.
Well, I don't know that the question is particularly relevant in the healthcare space, and the reason is because I agree completely with what Tillman says. You don't need to qualify a cyber operation as an attack. You don't need to take on the long-standing debate over whether data is an object to say that there is a violation of IHL because medical facility, medical operations, medical personnel, medical transport have been targeted by a hostile cyber operation, and it's interfering with the delivery of healthcare. But I do believe there are areas of IHL and regular and general international law that could be addressed by some principles of new with some new law, and I've suggested as much in a recent article in the Review of the Red Cross. But I think what we really need to be debating is whether or not we need a treaty or whether we need to throw all of our weight against interpreting current law. As you know, there are discussions underway in the UN on whether or not there should be a new treaty. I'm kind of on the fence on this one. I don't think we need a new treaty regime in order to address certainly the problems that we're seeing now, because I think the problems we're seeing now are well addressed in general international law. The question, though, is would it nevertheless make sense to write some of those norms down? If we look again at IHL, which is my first love, in 1977, when the conduct of hostility rules were codified in the additional protocol, that is not to say that those rules did not pre-exist the adoption of the additional protocol. So in terms of a treaty, I'm to some extent on the fence. But if the target of the treaty was to capture rules like you may not conduct cyber operations against health facilities, whether that is during peacetime or wartime, I think that would actually be a useful exercise, a restatement of existing law. Yeah,
so I my own writings, as Mike knows, I've done a fair bit of lex ferenda work, and I think one of the things to bring back to Maricha's comments is I think there is some general skepticism about some new global treaty for cyberspace and what those rules might be. On the other hand, if we are looking for a global consensus on anything, one might think that don't hack hospitals would be a fair starting point, even as it and codifying IHL in that respect, but also affirming, as I think Tillman, if you want to weigh in, the idea that we shouldn't have a world where hospitals are more protected in wartime than in peacetime, and it might be good to make sure that there's a specific clarification there, and you don't have to open up internet governance and the like to do that. But I don't know, Tillman or Jan, you haven't weighed in on this yet. I wonder if you have thoughts about the new rules question as well.
If I can, I would have two short comments. One is on what has been said about norms in relation to law. I think what's really crucial for us is that norms do not replace law. Law is much harder. Law is, as Mike said, has remedies. So if there are restatements of the law in the form of legally non-binding norms, that cannot replace law, and that must also be clear that it's not norms to fill a law-free area, but as something to complement and to maybe restate what's already hard and binding law. The question of is new law needed? I think I take up things that both Marietje and Mike said. It really depends on the operationalization and interpretation and application of the law that we have at the moment. And one concrete example here could be the question of data, including the question of hospital data. There is a debate in humanitarian law of whether data is protected as a civilian object or is not. And here, if we come to a conclusion that data is not protected as an object, that could mean that in hospital, digitalized archives, digitalized patients' data may not be protected against attacks, against deletion, against meddling with. We wouldn't take that view. We take the view that this data, especially in medical facilities, is protected, but it depends on how states interpret that. And if we come to a point where the majority of states takes positions that leave the civilian population at risk of cyber harm, then there is a real need to think about are new rules needed?
I'll chime in briefly just to say that, from our perspective, I think we've long been on the record and tried to pursue a goal whereby there is greater stability, security, and safety in cyberspace. How we get to that state, I think, is what is debated among those who prefer norms over a new hard law, and vice versa. And I would sort of say the reason why we ultimately think that something more binding can be helpful is in many ways the reasons that Mike articulated, and that is we have a lot of provisions we think in international law that have some great space. There are questions as to whether sovereignty, due diligence apply, or how those apply in detail in this context. And basically having an instrument that could clearly state what some of those protections entail would, in the absence in particular of countries to date having clearly articulated their views, lead us to a situation where there simply would be more clarity, and that in itself we think would facilitate this goal of more stability in cyberspace. So it's a long-winded way of saying anything we can do to get to a place where the rules are more clear, where countries know what is inbounds and what is out of bounds and adhere to that, is I think what we all should collectively pursue. And binding rules that can clarify what may already exist but may not be clear could be one way of getting there.
I would like to piggyback on that a little bit, because I think it's a really good point. I think in addition to putting down what you believe, what the law is, either you believe it is already the law or it is new law, you have to articulate that position. So let's take Jan's point on due diligence, which I'm a due diligence junkie. I think it's very, very important. In my mind and in the mind of many states of the world, that is in fact existing customary international law. But it will not hurt to write that down in a treaty, so long as when you become a party to that treaty, you say, we believe this is a restatement of existing law. Because if you fail to do that, suddenly non-parties to that treaty will say, well, we're not bound because of the treaty. But Jan's point is a good one, because it's win-win. So long as the state that believes it is customary law says it is a restatement, the other states that don't agree will nevertheless be bound by virtue of it being a treaty obligation, and then it covers everyone. And so I support this approach. I just think we need to do it somewhat surgically. We don't want to just, has been proposed in the United Nations by a couple of countries. We don't need to jump in and get a giant comprehensive treaty as if we're operating in a normative void right now.
Yeah, Mauricio, I'm wondering if you had thoughts that you might want to add on that point.
I broadly agree in terms of this is a space for clarification and restating existing laws in a modern context. But I wanted to also bring in one slightly different perspective, which is that we cannot only focus on the legal needs, even though that's the topic today. We should also look at, for example, standards of protection and cybersecurity norms that sometimes are lacking in terms of skills and awareness. For example, when hospitals are going to procure technology, if the knowledge is not up to date and if the standards are not, for example, coordinated, this is another way in which weakness is almost built in from the beginning. And I feel like there's a world to be gained from aligning that more. I know Anissa is working on that in Europe, but I feel like that's another way in which norms from another point of view, operational and technological norms, can actually be improved, all with the aim of avoiding perpetrators and criminals or states who are trying to inflict harm from having any kind of success.
Yeah, I think that's a great point on which maybe we can pivot a little bit to the point of operationalization. I think is a critical one, and you pointed out how important it is at the user level, whether it's in the hospital systems or the networks, improving cyber hygiene and cybersecurity, and thinking about that. I would add from my work at the Organization of American States. We were actually talking before we went live. One of the things we're seeing, even states could use some capacity building on some of these issues, both to understand the technology and the threat matrix, and also to understand some of these legal issues that we shouldn't assume sitting in the United States or in Europe that every foreign ministry in the world understands the debates that have taken place in the UN's first committee, and that we may need to build some more capacity. And so that would be my contribution to how we could operationalize both international law and norms. But I'm wondering about the rest of you. What can we do to move from words on paper to concrete actions to make what I think is a consensus among us on the panel that we want to reduce, if not eliminate, these sorts of attacks on the healthcare sector? How do we operationalize this? What can we do to make this more than a goal but a reality? Maybe I'll start with you, Jan, if that's all right.
Sure. Thank you, Duncan. I'll try to keep it brief. And I actually have some audience views on this as well, as if we could get them in. I'll say one of the things that we have consistently thought about is how do we actually, conceptually and in reality, this is a problem that goes beyond states' capabilities to deal with it, just like it goes beyond industry capability. And so the question really is, how do we bring everyone together and leverage really the true power of multi-stakeholderism in this context, and advancing cybersecurity, cyber stability, implementing norms, upholding law probably lends itself really well to that, as do capacity building efforts if they're done right. And so I think one of the just conceptually key pieces here is that we need to get even more effective at how we bring together partners from government and the private sector in delivering and capacity building and operationalizing norms. And I think each of us has something that we can contribute there. I'll point to a couple of initiatives. I think they're probably well known to but nonetheless, I think they are good reference points. One, of course, is the Paris Call for Trust and Security in Cyberspace, which was we think a really useful multi-stakeholder initiative that outlined 9 principles, which have now been endorsed by over 1,000 stakeholders from governments, industry, and civil society, including 78 governments. So that's an interesting starting point on sort of how do we further advance global understanding and mainstream understanding of what obligations do exist. And then on the capacity building side, I think it's really important to make sure that we start to double down on some of the things that have already been developed, rather than consistently and constantly inventing new things. Things like the Global Forum for Cyber Expertise was an early and really relevant start in this space. Figuring out how we bring more impact to those initiatives, be it through private sector commitments, governments, or civil society expertise, I think is what we need to pursue.
Yeah, thanks, Jan. I think in addition, your intervention made me also recall that there's a new proposal by the Mexican and Australian governments calling for further work on national implementation of the GGE norms. So I think, one of the lessons of this is that, there's work that states can be doing, there's work that as Maricha said, that industry can be doing, and as you point out with your reference to the Paris call, there's certainly space for multi-stakeholder cooperation. Tillman, I'm wondering whether from your own personal view or from the ICRC view, whether you think, how do we operationalize this more here?
And that's certainly one of the most difficult questions. And I would start with the point that Jan made, but then also go maybe as an example of how the ICC goes about that topic. And that can potentially, we do that in context of armed conflict, but it may also be useful for other contexts to think about. So the first, of course, is capacity building. It means these norms have to be known. They have to be implemented. The law has to be incorporated into national law so that it can then be enforced. That's one angle. The other one is those threat actors, and be they state or non-state, they need to know them. And they need to apply and operationalize them. So there is a need for dialogue with those operators, be they state, and if they are accessible, also non-state operators. And one thing that I found really interesting, or find really interesting in the debate, is often law and norms are the strongest if they correspond with customs and ethics and their own values. And what I found interesting in March, when some of these hospital attacks occurred, there were hacker groups saying, we don't do that. That's something that we will refrain from doing, even though it may be lucrative at this point in time. So linking in international law and norms to their own ethics and beliefs can be a powerful way. And then, of course, as a third step, there needs to be, when these norms are violated, it needs to be called out. What the ICSC does here is confidential dialogue. So we don't call out in public, but we intervene confidentially, bilaterally, to point to law violations. But then there are other forums that can call this out publicly. And I think that's also one angle that has to be considered.
So I'm making a list of ways to operationalize. One is Jan's point about bringing the multi-stakeholder community together. And then I'm hearing the ICRC lessons about internalization, that is getting things reflected in domestic law, but then also the kind of naming and shaming as an approach, whether done confidentially or done publicly as a vehicle to kind of get people to accept these norms exist.
Maybe call it a constructive dialogue.
You call it a constructive dialogue, yes. And social scientists call it naming and shaming. And there is some differences, particularly, I think, given the confidential nature of what the ICRC has done quite successfully over the years. I want to let Maricha maybe close out. But Mike, first of all, I want to see if you had any thoughts in terms of operationalizing international law in this space. What can we do to give the law? I see a number of comments have kind of talked about the lack of teeth. That unless we have real, concrete teeth to the law, it's not. We shouldn't be putting our trust in it. So, do you have any closing thoughts on how we could operationalize this? And then I'll let Maricha tell us where the Cyber Peace Institute can fit into the conversation.
So very briefly, 112% with you on the multi-stakeholder approach. If you take the Microsoft Digital Geneva Convention, some states pushed back on that. It accelerated the conversation in a very positive way. Name shame is not enough to say for states to say, others, non-state actors to say they violated international law. That does not help us. They need to say they violated the rule of sovereignty. They violated the prohibition on intervention. They failed to comply with their duty of due diligence, because these broad sweeping statements of illegality are nice, kumbaya, but they don't really add anything to the dialogue. So we need some granularity. The discussions among states and non-state actors need to become more granular. We are really operating at the wave tops with statements like, is sovereignty a rule of international law? Come on, of course it's a rule of international law. We need to be having a discussion about which cyber operations violate sovereignty, and that's true with regard to due diligence. It's true with regard to the rule of intervention and what coercion means and so forth. And very few states have done this. France, the Netherlands, Australia, the United States a little bit, but most states, Finland, Estonia, but most states have not done this. And finally, Tillman's point is really good. Capacity building, because listen, when I travel around the world and talk to government officials who have cyber portfolios, they simply don't understand the law. And until they understand the law, we are only going to have wave top discussions, and they're going to be confused discussions. So we need to have lots and lots of capacity building.
Thanks. I'll echo the capacity building, and I'll flag, I have a recent OAS report that tried to add a number of additional states took up the sovereignty mantle. Maricha, we're running really close on time, but I really think it's important to let the CPI perspective on operationalization be heard here. So if you have any maybe kind of closing thoughts as we come to a close on this conversation.
Thank you. I'll be very brief, but I think it's important, as a lot of people that are listening are getting to know the Cyber Peace Institute, to share that we very much believe that the digital and the cyber space is a human space, and that we should look first and foremost at the most vulnerable victims of cyber attacks, and also bring it into the popular debate, not so much only in the realms of diplomats and technology experts. So that's one part. Second part is that we very much believe in evidence-based analysis of the attacks, so that we may better understand where they come from and play a part in making sure that there is attribution. I mean, that is primarily the role of states still in the world that we live in today. But if we know more about the attacks, maybe the pressure can be applied, and, with this knowledge, the debate can be had about, who did it and what the consequences should be. And obviously we believe in advancing, developing norms, responsible behavior, and international law. And I think the monitoring of existing norms and commitments that different actors have made can play an important role too. It is often quite easy for politicians, governments, and even companies or international organizations to sign on to some kind of statement. It's a nice press moment, but it's really important to then also follow through and look at whether people, if you want to call it due diligence or compliance or whatever may be the best term, to see whether those parties have lived up to the expectations. So I believe this is a very dynamic field, and I've appreciated all the comments, and I hope that it will contribute to keeping people safe in these times where the virus should be our biggest enemy, and not attacks waged against health facilities that are actually housing people that are in deep medical trouble, or people that are risking their own lives to save them.
I think that's eloquently put. I think, as we think about law and norms in the space, it's important to think that not only does it prohibit bad actors from doing bad things, but as you say, it provides a flag around which others can rally, that they can work to combat both these cyber operations, but the true enemy right now, which is COVID-19 that we're all facing. I haven't been able to get all the live comments in, and I apologize for that. But the CPI, I think, is trying to establish a norm early on of having timely 1-hour webinars, and we're a little over. So I'm going to ask you all, virtually to clap your hands to thank our panelists, Jan, Maricha, Tillman, and Mike, for a great conversation, and I hope it's the first of many. And thank you for joining this Cyber Peace Institute webinar online event, and hopefully you'll come back and we'll do something similar again soon. Thank you.
Thanks very much.
Thank you so much. Bye-bye.
Bye now.
I think we're still live.
I think we are. So I'm going to sign off.